Imagine providing weeks of care to a patient, multiple visits, skilled nursing, therapy sessions, only to find out you're getting paid absolutely nothing, zero reimbursement. That's not a nightmare scenario. That's what happens every day to agencies that don't nail their home health eligibility verification process. In the next few minutes, I'm going to walk you through exactly how to verify eligibility the right way, when to check it, and the specific red flags that will save your agency from potentially devastating financial losses. Here's why this matters more in home health than almost any other healthcare setting. You're not billing for a single visit. You're providing care over extended episodes, sometimes 30 days, sometimes longer. So if you discover a patient wasn't eligible after you've already completed an entire episode of care, you've just worked for free, and that's not sustainable for any agency. So let's talk about how to actually do this, right? Starting with Medicare patients. For traditional Medicare, you've got a few options for verification. Palmetto patients go through e-services, NGS patients use NG Connects, and then you've got third-party services like Waystar and Availity that work across both systems. But here's where most agencies stop short. They confirm Part A or Part B coverage and think they're done. They're not. According to CMS regulations, you need to verify eligibility, including homebound status, both at the initial assessment visit and at the comprehensive assessment. But beyond that baseline requirement, there are 4 specific things you need to check every single time. First, active care conflicts. Is this patient currently receiving services from another home health agency? If they are, you can't just admit them. There are specific protocols you have to follow first. Second, hospice status. Now this one trips people up. Patients under hospice care can actually receive home health services, but only when the diagnoses don't overlap. Miss this distinction and you're looking at a denial. Third, coverage dates. You need to verify both the effective start date and any potential end dates. Make sure that coverage actually spans your intended episode period. Sounds obvious, but it gets overlooked constantly. And fourth, Medicare Secondary Payer status. Understanding MSP helps you determine primary versus secondary payment responsibilities, which directly impacts how and when you get paid. Now let's shift to commercial and Medicare Advantage plans because this is where things get more complicated. With commercial plans, you're dealing with a whole different layer of financial considerations. You can access patient information through Waystar, Availity, or directly through the insurance company portals. But unlike traditional Medicare, these plans are going to show you coverage percentages, copay requirements, and deductible status. And here's the business reality nobody wants to talk about. You have to determine whether your agency can actually afford to serve certain patients. High copays, unmet deductibles, those aren't just billing details. They're business decisions that affect your cash flow and your ability to keep the lights on. But here's what I really want you to understand about home health eligibility, and this is crucial. Timing is everything. The closer you check eligibility to your start of care date, the more reliable that information is going to be. Eligibility status changes constantly, insurance switches, patient transfers to other agencies. And yes, sometimes patients pass away between when you checked and when you start care. Pay special attention to admissions near month end or year end. Why? Because that's when insurance changes happen most frequently. A patient whose eligibility you checked on December 20th might have completely different coverage by January 1st if they switched from Medicare to Medicare Advantage during open enrollment. Now, one more distinction you need to understand: pre-authorization. Traditional Medicare typically doesn't require pre-authorization for home health services, but commercial and Medicare Advantage plans, they almost universally do. Yes, it's an extra step in your admission process, but think of it this way. It's also confirmation that your services are going to be covered before you start providing them. Quick side note, some Palmetto regions are piloting a pre-authorization-like process called RCD or PCR. It's still in trial phases and hasn't rolled out nationally, but it's worth keeping on your radar. And here's something that separates good agencies from great ones. Home health eligibility verification is not a one-time process. Best practice, rerun eligibility checks before each recertification period. Under PDGM, that's typically every 30 days. Coverage and benefits can change between episodes. And discovering an eligibility issue during recertification is infinitely better than discovering it after you've already provided the care. This also ties directly into your billing. Don't wait to submit multiple claims at once. Submit claims as soon as episodes are ready. Because if you discover an eligibility issue with one claim, it probably means other pending claims for that same patient are going to face denial too. Finding out early limits your exposure. So let's bring this all together. What should your home health eligibility process actually include? Initial verification as close to the start of care date as possible. Documentation of coverage details, copays, and deductibles. Verification of network status for commercial plans, regular re-verification before every recertification, and clear protocols for handling eligibility conflicts or gaps when they come up. This might feel like a lot of administrative work, and honestly it is, but thorough eligibility checking is the foundation of your entire revenue cycle. It protects your agency from providing uncompensated care. It's the difference between profitable episodes and devastating financial losses. In an industry where margins are already tight, this isn't just best practice, it's survival. If you're looking at your eligibility verification process and thinking it could use some work, or you're dealing with eligibility-related denials that are hurting your cash flow, we help agencies build systematic processes that catch these issues before they become write-offs. Book a call with our team, and let's walk through what a tighter eligibility process could look like for your specific situation. If this was helpful, subscribe to the channel so you don't miss our next video on home health billing. Drop a comment below if you've got questions about eligibility verification. We read every single one, and share this with another agency owner who needs to hear it. We'll see you in the next one.